Are you ready? Hi, I'm Travis Ulerick. I'm a firefighter and EMT here in Dublin, Indiana. I hosted a healthcare community discussion, and this is my town. Dublin is your all-American small town. Everybody knows each other, everybody sees each other out, everybody cares about each other and what's going on. The problems they have here are probably the same they see all across the country, is the fact that we have uninsured people. They can't afford the insurance, or they're not provided the insurance. They can't afford health costs. They can't afford ER visits. They can't afford ambulance rides. There's no opportunities to get preventative care. There's no opportunities to access those things that could prevent them from having the problems that they have to deal with down the road. Whenever Change.gov started posting listings that they wanted to host healthcare discussions, I'd actually talked to my mother, and she encouraged me to stop complaining about all the problems I saw on the job and actually do something about it. So I decided that this was my opportunity to host a meeting and get people together and actually try to talk about the issue and at least give our opinion.
My son and many other people that was actually born with these illnesses, they cannot control. How are they going to get health care if they have pre-existing conditions? Something that's been there, he has no choice of.
This is Deanna Russell. Her son is Kyle Russell, 13. He was born with a congenital heart defect called Epstein's anomaly. She attended our healthcare meeting and shared her story.
This right here is Kyle Russell. He's 14 years old now, and he's had a hard life. He keeps going. Looking at him, you wouldn't be able to tell that there's actually something wrong unless you actually see all the scars or him in distress. Then you'll know. Here's one when he was still in the hospital. I didn't get to hold him until he was almost 6 weeks old before his procedure. And actually, I held the pillow that had him on it. It was okay. It was better than not. Still not the same. No, not even close. Yeah, he's been through a lot. And like you said, for them to later on, you know, you fought this long, sorry we can't help you any farther. That was just, that's not even cool.
I think you brought that up at the discussion. You know, he's going to grow up, get a job, and they're not going to cover him healthcare wise. That's not fair to him.
No,
not at all.
Once he gets a job, the Medicaid's not going to cover him.
Exactly.
I mean, is he going to have to be poor all of his life to be able to have insurance?
I don't think it's right for the insurance companies to have that much control.
I think definitely there are people that I guess maybe have better influence and money, and I think the system seems to work well for them. It is the best system in the world for those people. It's the people that don't have the money and the people that don't have the privilege that it's maybe not the best system. It's, yeah. This is Dr. James Birch. He attended our healthcare meeting. He runs the local doctor's office.
We run a family practice. We're the only doctor in several miles, and we do everything we can that the community needs.
So roughly how many patients do you see during one day's period?
Between my nurse practitioner and myself, we'll see between 60 and 70 patients in an average day. The reason why we're so busy is that we have an open door policy. We're always taking new patients, and we try to take every insurance policy available. We take all the Medicaids, all kinds. But then there are a lot of doctors who are refusing to take Medicaid. A lot of doctors are refusing to take Medicare. A lot of them are only taking cash pay patients, and they can get by seeing probably a third of what I see and make the same money. That's not what I choose to do, and I understand why they're doing that, but how does that help the community? If I did that in this community, I would be of little value. So somehow we have to help the primary care physician like myself survive. Community health care is very, very important, because if that doesn't work, the whole system just kind of fails. It won't work.
President-elect Obama wants to bring the voices and healthcare concerns of all Americans to Washington.
After the discussion, we got together and we just pretty much went through it systematically and tried to pull out all the key topics, and we listed them down and tried to answer all the questions that the Obama health policy team asked, and pretty much just get an overview of everything that we talked about at the meeting.
The fact that people have lost their primary care doctors.
My hopes and dreams are that the health policy team pretty much systematically went through everybody's responses and just try to get a rough idea of how everybody, all the American people feel about the issue, and what we think are the problems and what we don't understand about the problem and what we think may be possible solutions to the problem. And hopefully they take that information and everybody can work together and we can get some health care reform.
It is interesting, you know?
Was
What a rare chance you get to kind of look into the inside of kind of all these community discussions and see what people think. So.
Oh yeah, I was saying how people express things and really get their thoughts and feelings about it and how to move ahead.
And our whole hope is that harnessing this information, hearing these voices, we can then learn what works, what doesn't work, and translate that into the type of plan that the American public wants, needs, and can be enacted. So
that's great.
Hopefully a year from now we can all be celebrating and implementing the plan that we are helping to develop today.